Harry, do you like the Affordable Care Act, also called Obamacare? Why or why not? And if you want to repeal it, what do you say to the 35 million newly insured people?
I don't like it at all because it did nothing to lower the cost, to rescue the financial problem of Medicare. We have over $50 trillion of unfunded liabilities already that are on the books that we don't talk about. This is crazy. It's total insanity to keep going down that path. And as I mentioned, we don't need the insurance. We need health care from professionals who are not commission-based, like they do in the Army and the Navy. That is the only healthcare system we can afford in this country. That's what we should use that model that exists in the Department of Defense and scale it up. And we should encourage and pay for the medical educations of any young, bright student that wants to go to medical school. We shouldn't charge them horrific loans to students like we're doing now. That should be a free education as long as they agree to serve X amount of years as they would if they went in any other form of work in the military. That we can move on immediately, okay. And then we don't have to worry about dentists drilling perfectly good teeth because they want to make a few extra bucks to go buy a boat. That's what we've got to get rid of, is that corruption and that greed, and get it out of the medical system and the educational system entirely, and then we can really begin moving forward.
Okay. By the way, Santa, I think we saw your whole house and your outdoors as well.
Yeah, power cord failed and I had to move it. Sorry.
Oh, okay. All right. Well, except we got a nice tour. JL, you want to talk about the ACA?
Oh, that would be gone. However, I do like the idea of if you have to buy insurance, the pre-existing conditions, that has to be a mandatory thing. You can't deny someone insurance if they choose to buy insurance because they have a pre-existing condition. That's wrong. The major cost in healthcare is not the doctor's fees, because the doctor would charge you a couple $100 for a very major procedure, and that's it. The cost is coming from the usury repeat and the constant repetition of that usury, trying to pay it off for the research on those pieces of equipment, and the research, which came mostly from grants that was paid for through usury because it was taxpayer money, and that is 100% usury, 60 cents on the dollar to be repaid, and that will never be repaid unless it's declared a national security threat and we get rid of the Federal Reserve. We turn around and technically we could pay that off with a single coin.
Okay.
Go back to people showing up at the doctor, paying for their basic service, unless they want to have insurance. They could pick and choose what they want for their insurance company. It'd probably be cheaper to just show up and pay a few $100 to have that child, or to have those extra teeth drilled, or as Obama would say, the foot cut off when it didn't need to be cut off. Sorry, Harry, but that was kind of funny. The extra teeth drilled. It reminded me of when President Obama was talking about the amputated foot when it didn't need to be amputated, and that was just kind of funny.
There's thousands of unnecessary procedures every year, and many of them cause serious injury to patients.
Okay.
Not to mention the cost to the system.
I know.
We need to move on. Santa, you want to address ACA and whether you like it or not, and if you don't, what do you say to the 35 million people who are now newly insured?
I think it's a good thing the 35 million who are newly insured are insured. I agree with the ACA for the most part. I'm still a single payer advocate, so we'll see how that changes through the years. I think it's interesting how the states are reacting to the ACA, and some of them are moving monies around and requesting different monies for things and trying to express either their pleasure with or displeasure with the ACA. So I think it's having a bigger impact at the state level than most people thought it might. But generally speaking, I'm in favor of it.
Okay.